journalist, by the way.
Very true. Dr. Ahmed, I know I've run out of time, but of course, like you said, as a journalist, just for 3 seconds, what would you like to see as my headline tomorrow after leaving this session? What would you like to tell your partners as a headline that you would see tomorrow and say, I said that, and that should ring a bell to all our partners across Africa?
Partners support Africa CDC's new public health order.
A round of applause. Thank you very much, Dr. Ahmed. Please, another round of applause as we support the partnerships. Thank you, Dr. Ahmed. And now, just to take you through a very short exercise. If you have your phone, please hands up. Do you have your phone with you? I promise I won't take them. Thank you. So, the technical crew at the back, if you kindly please help me bring up the scan me, not me. Please, let's scan your phones. You will get menti.com. If not, just go straight to www.menti.com. Are we there? Anyone need some technical help? www.menti.com or quickly scan. Are we all there? Yes. Now on that page, you'll find a couple of questions. Please fill in. Please answer those questions. This will help us know what you think about the partnerships and the result-oriented partnerships. Yes, I see collaboration, accountability, respectful, transparency. When you think about the action-oriented partnerships, what does it mean to you in one or two words? Coordination, impact, trust, respect. Trust, collaboration still comes out, accountability, mutual benefit. Thank you very much, ladies and gentlemen. Please, a round of applause. Clap for yourselves. Thank you. We now go to another very interesting discussions where we'll be having partner discussions with 6 partners that are examples of the partnerships of Africa CDC that have been able to be the Ghana. This will be led by Dr. Teresa Maduboko. Over to you, Dr. Teresa. Please, a round of applause as she joins me on stage.
Hello. Yeah. Good evening, ladies and gentlemen, and thank you so much for sharing your valuable time with us this evening. So, without any further delay, I'll just introduce the members of the panel that we have here with us this evening. So first of all, I'd like to start by inviting Dr. Kopano Matlwa Mabaso. So she works with Bill and Melinda Gates Foundation, and she's a Senior Program Officer, Health Africa. And she has a very, she has a very exciting background in the sense that she's responsible for strengthening and advancing the Foundation's regional and continental health portfolio, as well as she's a medical doctor by training, but she's also an award-winning fiction writer, and she has novels, Coconut, Spilt Milk, and Period Pain, which have been translated into a dozen international languages, and her debut novel is actually currently being adapted into a feature film. So I think that's quite impressive here. So, and she's one of our partners. Good. And then next we have Ernst Masaya of the World Bank Group. I believe he's joining us online. Yes. So Ernst currently serves as a practice manager for health, nutrition, and population in the World Bank East Africa region. He holds a doctorate in public health from Johns Hopkins. He has a master's from London School of Economics, a BA from University of Waterloo, Canada, and he served as a practice manager for health, nutrition, and population in the Middle East and North African region before assuming his current post. And prior to this, he has held positions with the UN, Commonwealth Secretariat, Inter-American Development Bank, and CARICOM Secretariat. Please give him a round of applause. And then we have Prof. Roma Chilengi, who is here with us in person today. Prof. He's a Zambia medical doctor, epidemiologist, and professor of vaccinology. And thank you so much for prioritizing us today. He presently serves as a Director General of the Zambia National Public Health Institute, and he has led diverse research programs on enteric diseases, vaccine research, covering pathogen biology, field epidemiology, and clinical trials, with a strong bias to vaccine development. Next, round of applause, please. Thank you. So next we have Dr. George Alfred Kizebo of the WHO. He's the head of the WHO Office to the Africa Union Commission and UNICA. He was previously WHO representative to the Republic of Guinea based in Conakry. He has 30 years of experience and expertise in health, emergencies, social and human development. He also has a medical degree and a fellowship in infectious diseases, international health and development. And he also has an MPH in epidemiology. A round of applause, please. And next we have Dr. Simon Nyovura Antara of AFANET. He's a medical epidemiologist with a vast experience in public health practice and applied epidemiology. He's the director of AFANET, and previously before that, he served as the director of programs. He has worked as a resident advisor for a number of field epidemiology training programs in different countries, including here in Rwanda, also in Namibia, in West Africa, and in Ouagadougou. Please, a round of applause for him. And then we have Dr. Feni Ama. Dr. Feni is a senior research fellow with the Institute of Statistical, Social, and Economics Research at the University of Ghana. She's a health economist whose research focuses on the evaluation of health and development programs in low and middle income country settings. In these settings, she studies the role of health financing strategies in offering social protection to vulnerable groups. Also working on targeted health system strategies to improve health-seeking behavior and costing and cost-effectiveness methods that address the efficiency of health programs. You're welcome. A round of applause, please. And last but not least, we have Dr. Agne Sukat, who will be joining us online. She's currently the head Division of Health and Protection at AFD, Agence Française Développement, or something like that. Excuse my pronunciation. She's been the Director of Governance and Financing of Health Systems at WHO previously, and she has also worked with the Africa Development Bank and the World Bank. And she has developed an expertise over 25 years on issues of poverty reduction, health financing, social protection in more than 70 countries in Europe, Asia, and Africa. A round of applause for her as well. So, thank you so much for being here today. And as you can see, I have a very diverse panel, and also very knowledgeable. So we look forward to very exciting discussions. So I'm just going to start right with Dr. Agnes. Are we going to see her? So to Dr. Agnes, I want to ask, what is the vision from funding agencies to shift from often piecemeal approaches to long-term organization and systems-oriented support to member states and to regional institutions like Africa CDC? I don't know if we have her online. Hello? Can she hear us? Do I repeat myself? Or do we just move on to someone else while we wait? Okay, all right then. So, Dr. Copano, it's your turn next. Yes. So how can donors from the philanthropic sector align with the goals and roles of Africa CDC and support the organization with flexible funding that supports public health preparedness within regional institutions, especially for the long term?
Thank you.
I think you have to press.
Thanks, Teresa. Yeah, thank you for the question. And perhaps before I start, just to say it's incredibly inspiring to be here. Congratulations to the Africa CDC. It's an incredible achievement. And it's wonderful to see the collective work over these past few days and exciting for what our continent is capable of doing. So very inspiring. I think as donors, we can ensure that we understand the strategic priorities of the Africa CDC and ensure that we fund initiatives that are aligned to those. And I think Dr. Ahmed touched on exactly that. I think an understanding that it costs money to deploy money, so ensuring that we make sufficient provision for indirect costs and that overheads related to innovative initiatives are adequately funded. We also all know that innovative initiatives, highly technical work, the kind of work that the Africa CDC leads on, requires highly skilled and talented people who want job security, want to be remunerated at a level that is commensurate with their capabilities and skills, want good working conditions. So as the donor and partner community contributing to building that kind of long-term, highly skilled capacity in our regional institutions so that these individuals can focus on the important tasks at hand. And then again, Dr. Ahmed alluded to this already, but COVID did teach us that the unexpected does happen. So as we program funds, ensuring that we've built in the necessary flexibility to allow our regional institutions to be responsive to evolving needs. And then lastly, pooling funding where possible with other donors and other partners so that we're ensuring maximum impact, a focus at the work on hand, minimizing reporting burden and efficiencies. But we don't want this to just be rhetoric, and so we as a foundation try to put our money where our mouths are. So in addition to funding a variety of initiatives related to pathogen genomics initiative, the COMSA work, countrywide mortality surveillance for action secretariat, the health economics unit, supporting the PAVRM secretariat. We're really proud that about a third of our programming and funding to date has been focused on developing core capacity, again, because we know that you need highly skilled people to do this work. And we're excited about the next phase of Africa CDC's work as we come out of the fog of the pandemic and look forward to how we strengthen health systems on our continent and look forward to continuing the partnership.
Thank you very much. So you said some very important things here, like the work that you're doing, our partnership where you've really supported us in capacity building, and also the need to remain flexible because you never know what happens in future. And also I loved your statement about that it costs money to deploy money. And I think I'm going to be quoting that one in future. And it's so true that we really have to sort of think about that when we're working on our budgets and our plans and our work plans. Thank you very much. So I'll move to the next panelist. I think we go online now. Are we ready? So that we can go to, so do we take Dr. Agnes? Or do we take, okay. So we take ENST. Yeah, okay. So now we're going to be talking to Ernst Messiah of the World Bank. So, hello.
Hello.
Yeah, hi. Nice to have you with us this evening. So, first of all, I want to say congratulations to the World Bank, for the grant of 100 million US dollars that has been given to Africa CDC, which is one of the largest investments that the World Bank has directly made to a regional institution, and demonstrates, really a good partnership that we're working together and hoping to build in future. And my question to you today would be, how do you see this grant as transformational for African countries and the continent as a whole? And what would you actually like to see as the next steps building on this?
Well, perhaps let me put it into some context, because our first grant to the Africa CDC was in 2019 in December. We didn't know that we were on the doorsteps of a global pandemic. And what we saw with the initial funding, which was 10 million in that first grant to the Africa CDC, was, I think someone earlier on mentioned that the Africa CDC is just 5 years old. And maybe I'll say it's a 5-year-old that skipped primary school, secondary school, and went into university immediately because of the challenges of COVID. So it had to grow up really very fast. And in that process of growing up, a couple of things were important. One, there was clarity on the need for an Africa CDC within Africa. There was also clarity on a vision, an overall vision that Africa CDC as to how it would approach dealing not just with COVID, but with protecting the health of populations in Africa. And then thirdly, and importantly, the strategy as to how to move this forward. So when it came to the question of should we renew the grant and what additional funding, there was a performance, results, capacity, vision as to how this would move forward. Now, a couple of things I see are important for us. One is the whole question of how does national development move forward when you have regional institutions? What's the role of regional institutions, and how does one deal with regional public goods in 2022 moving forward, and where the Africa CDC and its work on pandemics is part of the bank's approach to supporting regional public goods. So that's critical. I think secondly, when we look at the work of the Africa CDC, it's not just looking at pandemics and emergencies, it's an important element in strengthening health systems. So what we were able to do with the support for Africa CDC is to look not just at it as a regional institution, but thinking very carefully, a regional institution that had linkages at the national level. And so we could strengthen a continental response, the regional responses that we have in other operations, and link that to our national operations. So it's a whole system that we're looking at supporting from the ground at a regional level and a continental level moving forward. Now, I like your question as to why is it transformational? And if we look at health, if we look at the role that Africa needs to play to ensure the health of its people, let's put it this way, not having an Africa CDC does not transform the continent. It doesn't put the onus of responsibility for the health of people in Africa in the hands of African institutions. And the transformation is, for us, being able to support an institution like Africa CDC that is moving forward with a clear vision of what Africa must do to be able to protect the health of its people and ensure that the developments technological, in terms of surveillance, are in the hands of people in the continent and regional institutions. So this is really part of, I hate to put it in this context, this is part of nation building, this is part of building and strengthening the continent, and this is very much part of the goals of the African Union, and the bank is very pleased to support them. Thank you.
Thank you so much. Those were really strong, positive words towards Africa CDC, and the fact that there was a need for Africa CDC and we stepped into the space and we did not let
I think we've lost the connection.
Of the Finkel's box. We leverage our funding what we call centers of excellence across Africa. There are several of them here in East Africa. Even here in Rwanda, we do have several centers of excellence. And we know that, in essence, these centers of excellence are supposed to build capacity. So they're building the capacity of our future health workforce. And what we can't really tell as we read the mandate of Africa CDC is an intentional strategy to connect with academic institutions in Africa to build this capacity going forward. We do know that quite a number of academic institutions are doing so much work in research and also in bringing up the kind of capacity that will help us in our countries. But many of the times we see that the direction of funding actually determines who gets that kind of funding, which academic institutions get that kind of funding. So we know that we need to build these robust networks across Africa. And we see that Africa CDC has the role to facilitate this process, create that kind of hub where it can engage with all our institutions across board, irrespective of who gets funding or who does not. And we expect that as these roles are being played efficiently by the Africa CDC, it will be a win-win situation where our institutions also build the capacity to be able to win whichever grants they need to continue to churn out the kind of health workforce that we need in our various institutions. Today we were in a panel, and one of the questions that came up was, you have all these graduates coming out of your academic institutions, but we don't seem to be able to use them immediately when they come out, and what seems to be the gap? And my take is that we have not engaged enough with industry. We have not engaged enough with the people who need the workforce. So we may have to start rethinking how we develop our courses, for example, how we engage with private sector, how we engage with those who need our workforce. And I hope that Africa CDC will be intentional about, bringing up these issues as it goes on with its mandate to build the health workforce it needs. Thank you very much.
Thank you. Thank you so much, Dr. Feni. So what I'm hearing from you is that you are advocating for centers of excellence and building the capacity of different academic institutions, but at the same time you would like Africa CDC to sort of partner further and to coordinate the process. Okay, all right. Thank you very much. We now move to Professor Roma Shilenga, the Director General for the Zambia National Public Health Institute. And to you, I'd like to ask that National Public Health Institutes are the implementing agencies for the country's national action plans for health security. How can regional institutions, Africa CDC, to be exact, sort of work with MPHIs, especially in the area of South-South cooperation, to support and strengthen public health capacities in the different member states?
Yeah, thank you very much. And I think just to acknowledge the great organization that has gone in to have such a successful conference, and I think that things are going so well, and it's pretty good to be here. And thank you for the question. And I want to begin to answer that question by firstly recognizing the context that Africa CDC does have a very high mandate, which is really derived from the heads of state at the continental level, and a very clear mandate at which, through which the heads of state have connected Africa CDC to every country on the continent through the National Public Health Institutes. And I think in terms of partnerships, that already accords Africa CDC a very robust structure to achieve what it needs to achieve. And perhaps part of the reason why in a very short time, seemingly Africa CDC is doing very well. But I want to say that mandate and that leadership structure can be exploited further to ensure that those goals are well achieved. I don't want, in answering this question, to dwell on the sort of national level activities, since you want to talk about the regional level South-South activities. But I think that in the new public health order, we are given very clear pillars of what the focus activities need to be. And for lack of time and for very personal bias, I want to pick on the one that is listed in the second place and touched upon in the fifth place, that speaks to local manufacturing and production. And so you will excuse me if I don't touch on the other aspects. I think this will drive my point stronger. I think that the partnerships that Africa CDC can drive are in a very strong position to utilize that frame and push the agenda for local manufacturing and production. And I think that we need to find ways that this objective is not just rhetoric, or is not just talk at a higher level. It is actually implementable, and there are steps that are being done on the ground to implement that. But how do you do that? I think that firstly, the mandate of Africa CDC and the National Public Health Institute is much broader than COVID. Thanks to COVID, it gave us the sort of the galvanizing jump into what we do. But I think that there's a whole lot more that we have to deal with in order to deliver that public health and achievement that is required. So issues of manufacturing must not be restricted to vaccine production. I think there are allied commodities that we need for health security. We do need PPEs, we do need diagnostics, therapeutics and allied materials, other equipment, some of which I think is already happening through the sort of continental level organization. But I think that added to that, I want to say that there is already some manufacturing that is going on in Africa. So while it is desirable that we begin to see African manufacturers make vaccines or new drugs, I think there is already manufacturing happening in Africa, and Africa CDC has the opportunity to take advantage to move this agenda of supporting local manufacturing. Now, I think that Africa CDC has the muscle to utilize the continent-wide reach through its mandate, but really also look at Africa not as the way we look at it at country level, but this is a market of 1.3 billion people, or whatever number that is. So if we are going to promote local manufacturing, it means that our local companies need to be profitable, and for them to be profitable, they need market. And some of our international partners may not like this, but I think we need to find a way to prioritize local buying into the continent manufacturers. I think that the sort of efforts that went into, for example, securing vaccines through the Harvard arrangement, why can't Africa CDC pick on initiatives like that so that they secure a continent-wide sort of market for our local manufacturers within the continent? That way, they begin to empower them, even as you look to the future towards novel products and products that we need for public health activities. We can actually begin with what products are already there. And I think that we can begin with securing that market. And I think that at the continental level, I'm not aware that there is any other arm of the African Union that has such an efficient and effective reach as Africa CDC, and that it can utilize actually the other continental arms of African Union, those that are focused on commerce, the regional bodies, etc. I think we need to figure a way to start galvanizing those to support local industry and local manufacturing so that we can begin to see more out of that. And I think that we also need to look at what problems are facing the countries in the continent. I think that COVID, yes, has taken a huge precedence, but we have cholera outbreaks spotted here and there on the continent. So it would be important to see tangible efforts coming out of Africa CDC and leading us to basically intervene and mitigate and take that role. I think that the silence feels a little bit like abandonment. But I think if we are talking about the new public health order that moves us to avoid that word Dr. Ahmed is avoiding of a pandemic, I think that we have outbreaks already spotted here and there, some of which we already know what to do. And I think we do have the muscle to deal with. So I think at the continental level, because some of these problems may be within the region and countries may not find it easy to engage, but I think at the regional level, we need a reach and a coordinated effort. I think we've been told already that you are not safe until everybody else is safe. And I think that when we have some of these outbreaks in our neighboring borders, something needs to be done. And I think that we need to move the agenda from, just specific areas of interest that are dictated by funding flows to actual priorities of the problems that countries are facing within the region. I know time is not with us, so I want to also just say that the research side of research and development requires attention, and I think utilization of the limited health workforce that Africa CDC and other partners are supporting is something that can be utilized at continental, subcontinental level. I'm talking about our well-trained workforce who may not be very active in other areas where there isn't an outbreak, but within the region there are other problems. We can mobilize, we can coordinate, and have an impact at continental level. I think we need to be moving as one region as much as possible. So regional deployment of the workforce is something that can be done to enhance our partnerships and networks. Thank you.
Thank you so much. I mean, you've shared in such a passionate and practical way. And in fact, it's even a challenge for me to summarize everything, because he sort of went around everything that we've been talking about this evening. But yes, we hear you at Africa CDC in the sense that there needs to be local manufacturing, and also that the focus should not just be on vaccine production, but we should also sort of widen the scope. At the same time, when you said silence, I think that also brings us to what Dr. Ahmed was saying this evening, that we should publicize our work more, because obviously there are areas that we are working in that are not being sort of presented or heard about as much as they should be. But thank you very much, and you've challenged us, and we'll take up the challenge. Okay, so we'll now move to Dr. George Kizebo of WHO. Over the past 5 years, Dr. George, the partnership between Africa CDC and WHO has been growing and evolving. And as we look to the future, we'd really like to hear from your view how we can work together more seamlessly, and how can we better strengthen and build the work relationship and partnership between the two organizations.
Thank you very much, Teresa. I would like to acknowledge the authorities of Rwanda, co-chairs, the African Union, the Africa CDC, my brother Ahmed, the director, the partners who supported this event and were present here, and also my co-panelists. WHO and Africa CDC are, I would say, natural partners because there is an history of WHO working with the African Union. And I remember since the previous pandemic of HIV/AIDS, WHO and other UN agencies working very closely with the African Union. So I think it's only natural that WHO has been part of the discussions on establishing Africa CDC. And I think the Director General, the Regional Director, in the address to the conference yesterday, mentioned how much the vision of a strong public health institution for the continent was relevant to the entire world, to the multilateral community, but also to the continent, to the regions, the regional economic communities, but also to the countries. So I think we are both member states organizations. We are secretariats, so this is another similarity between WHO and Africa CDC. And WHO is working really from the UN General Assembly to the continental level, the RECs and the countries, to really serve the priorities. And I think this country ownership has been really mentioned since yesterday as a key pillar of our action. We are here to serve the priorities of the countries. We do that through our governing bodies, be it the World Health Assembly, be it the Assembly of Heads of States, but also the technical bodies such as the special technical committees and our technical working groups, the networks of experts that are there in place. And we also look at really strengthening the systems. So I think the systems approach is very important. One of the things that we have learned, and it is also at the core of the DNA, I would say, of WHO and Africa CDC and other agencies, is that health equity is key, but social justice is key. It is there in the constitution of the WHO. We need to leave no one behind. This is there since 1948 when WHO was created. So it's very important that we build upon these commitments at global level. We have the Alma-Ata Declaration, we have the Astana Declaration, we have all the decisions from the Assembly of the African Union and the commitments on universal health coverage, social determinants of health. And when I look at the new public health order, all these pillars are covered. And we can only contribute together with Africa CDC. How are we doing that? I talked about governance. I think financing is very important, and we need to recognize the strong support from all the partners, multilateral, development banks, and even the private sector. We have seen how the private sector could mobilize resources during the COVID pandemic. We need also to look at innovation and research, evidence-based approaches and data-based approaches for impact at country level. I think we need to recognize that the locus of implementation is the community, and I think my brother Ahmed has mentioned that this is where we succeed or we fail. So we need to really localize our actions, and we are doing that through different engagements. There is an MOU between WHO and the African Union. There is an agreement between WHO and Africa CDC, and we are working through technical working groups. We have a steering committee where the director of Africa CDC, our regional emergency directors are sitting together and looking at ways to really jointly strengthen capacities through ministries of health, national public health institutes, networks of experts, collaborating centers, and centers of excellence. I think this is very important. And even this year, we had several successes. I think we discussed with the leadership of Africa CDC. We agreed that there is so much work to do that several Africa CDCs or several WHOs would not be enough. So we need to come together with a very broad partnership, CSOs, faith-based organizations, local governments, and really to localize and to land all these commitments to the level where the impact and transformations will happen. I would like also to talk about the accelerators. We have some of the accelerators that were mentioned are the public health approach, the essential public health functions, including the countermeasures that need to be put in place so that we are better prepared for the next outbreak of the, even worse, the next pandemic. We need to have surveillance systems that are robust, that are real-time, that are community-based, that are based on events, but even on open sources. We need to scan open sources to see what are the events that are happening. We need to use, for example, climate data, environmental surveillance, and other approaches to have more robust means to detect threats. Secondly, in terms of response, we discuss workforce for better response. We are improving in the recent epidemics from DRC to Guinea to now Uganda. We now have better agile response capacity. So how do we together put in place this surge capacity so that in each of the countries of Africa, we have a workforce in all the pillars of emergencies response, be it coordination, be it laboratory, care, risk communication and community engagement, and this is happening. Our teams are going to countries now and supporting countries to put these teams who will be able to be deployed in the 24 or 48 hours after a threat is detected. I think this is very important. We have a joint emergency action plan with Africa CDC, and we are looking also at how WHO and other UN agencies can be involved in supporting the African Medicines Agency. The Director General provided a grant for the ratification process, and Mr. Michel Sidibe, who was the special envoy, was able to tour the continent, and this is one of the quickest ratification process that African Union has seen in history. So I think we continue to support African Medicine Agency, and Rwanda will be hosting this very important agency. We have a humanitarian agency after the Malabo Summit, which is also coming. So I think we need to come together and embrace the complexity of the nexus between health, humanitarian, development, and also peace. And I think all these issues are interrelated, and we need to embrace the complexity. We need to learn from the epidemic to take the opportunity within the crisis. And I will end by saying that really, moving forward, we need to use the 3 L's. The first L, and I would like to cite John Kengasong when we had this meeting in March. He said, why would we not have listening sessions? Listening sessions. I think partnerships is also listening. It's very important. And you can even convince somebody by only listening to that person. Listening is very important. Conversations are very important. This is why being here together is part of that movement, is part of that conversations. Africans say that life is a conversation. I think it's a very profound wisdom. Secondly, we need to learn. We need to accumulate learning. We are learning organizations. We learn from each more in terms of crisis, but in terms of peace. So we need to document, we need to accumulate knowledge, and then share that knowledge and prepare the future generations to use that. And finally, I think we need to leverage. Leveraging is really using all the assets and the commitments that we have, all the capacities that we have on the continent. Why did Africa resist to COVID? It's also because Africa is young. It's also because Africa is resilient. It's also because maybe the women of Africa, the youth of Africa are strong. So I think we need to really leverage all the capacities beyond the health sector with a multi-sectoral, all of society approach, and bringing all stakeholders together around the new public health order, around the SDGs, and also the Africa we want, the Agenda 2063.
Thank you so much, Dr. George. Thank you for sharing extensively. Thank you for also sharing on the areas of similarities where we sort of work and we partner, and such as the systems approach, health equity, social justice, and thank you for sharing the 3 L's. So as our time is sort of fast approaching and the end of the session is coming, we've saved the best for last, and we'll very quickly go to Dr. Simon and Tara of AFANET. So AFANET has supported Africa CDC operations and has been an implementing partner of our programs since our inception. Could you kindly share with us today how AFANET is sort of growing or evolving in accordance with our Africa CDC's expanding mandate, and how do you see our collaboration going forward? Could you also share with us some of the more important lessons that you've learned about funders who support that the funders who support our work would find useful? Thank you.
Good evening, and thanks to the organizers for the opportunity to share a bit on our partnership with the Africa CDC. We at the African Field Epidemiology Network are very excited that we are part of the great and noble efforts of the Africa CDC in executing its mandate of ensuring a healthier, safer, and a prosperous Africa. We see our partnership with the Africa CDC as a privilege to serve our continent, and our commitment to this engagement is sacrosanct. Throughout history, partnership has been the bedrock for human progress. Indeed, leveraging the synergy in our collective effort is catalytic towards achieving that which is long-lasting and most impactful. History abounds with examples on how partnership has changed the course of public health. The eradication of smallpox, the great progress towards the eradication of guinea worm and polio, the immense achievements of initiatives such as PEPFAR, Gavi, Global Fund, and all such interventions have leveraged the power of partnership. Achieving the goals of the AU Agenda 2063 requires the optimization of Africa's population health and then leveraging the energy of such a healthy population into various enterprises towards achieving the so much desired socio-economic transformation of our continent. Our partnership with the Africa CDC offers us an opportunity to contribute our bit to this effort. AFANET's collaboration with the African CDC precedes AFANET's collaboration actually with the African Union precedes the establishment of the Africa CDC. During the Ebola virus disease outbreak in West Africa from 2014 to 2016, AFANET worked with the African Union under the AU support to Ebola outbreak in West Africa, ASIOA, to deploy epidemiologists, graduates of AFANET member FETPs to support the response in the affected countries. 2 years before the official launch of Africa CDC in January 2017, AFANET received funding from the US CDC to facilitate the deployment of 10 epidemiologists to the AU headquarters, and the inaugural CDC, director of CDC worked with these 10 epidemiologists. Our initial support to Africa CDC operations focused on facilitating the work of these epidemiologists, including deploying them around the continent to respond to public health events. This has since increased to include an expanded human resource portfolio, travel and logistics, and fiduciary support. In July 2018, AFANET, on behalf of the Africa CDC, received a grant from the Gates Foundation to support key functions and facilitate the hiring of critical staff for the office of the Director of the Africa CDC. Shortly afterwards, in November 2018, we received another award from the Gates Foundation to support the establishment of mortality surveillance program at Africa CDC. The grants also facilitated staffing and operational support. In 2019, Africa CDC and AFINE signed a memorandum of understanding defining the scope and terms of our partnership. The scope of our engagement and the volume of resources made available to AFINET as an implementing partner of the Africa CDC grew steadily. With the COVID-19 pandemic, the volume of resources and the scope of issues in the partnership grew exponentially. AFINET is a level 1 implementing partner for the Saving Lives and Livelihood program. So how has AFINET responded to Africa CDC's expanding scope of work in the execution of its mandate? We are cognizant of the increasing volume of work in the mandate of the Africa CDC, and we have taken steps to ensure that we meet the corresponding demands on us as an implementing partner. As the demands on us increase, so have we increased the workforce dedicated to overseeing the Africa CDC projects that we are handling. So have we increased our search capacity across the continent. So have we strengthened our financial management systems. So have we leveraged technology to facilitate the work, and so have we strengthened and improved governance. Our partnership with Africa CDC has availed us resources, and that has enabled us to develop our capacity as an organization. And the dividends of such enhanced capacity we will always make available to the services of our continent. We also know that there's one room that is never full, and that is the room for improvement. We will keep improving upon the services we provide to Africa CDC. On the question of how we see the future of the partnership, Fiona asked Dr. Ahmed the same question, and his response is that the future is bright. If the director of the Africa CDC says the future with the partners is bright, who am I to say otherwise? So I agree strongly with him that we see a very bright future. We see this partnership like a good marriage. And like a good marriage, till death do us part. Like a good marriage, interdependence is of a higher value than independence. Like a good marriage, complementarity of efforts is critical for the attainment of major goals. Again, like a good marriage, all the days will not be blissful, but we can always focus on the bigger picture. And in this case, the bigger picture of a healthier, safer, and a prosperous Africa. I see a partnership with no growth limits. Finally, I'm asked to share our experience or some of the lessons we have learned that the funders who support the work of the Africa CDC could find useful. And I just want to share one. This key lesson is on the issue of public health emergency response. When it comes to public health emergency response, the need for unrestricted funding is critical. Why? Because at the beginning of a public health emergency, it is unlikely that all the response issues and needs will be comprehensively determined. I want to emphasize, I've been in so many emergency response, and I've been with Africa CDC in the COVID-19 response. It is unlikely that all the response issues and needs will be comprehensively determined at the beginning of the emergency. Indeed, as the emergency evolves, so do the needs, and this can happen rapidly. It is therefore important that at the beginning of a public health emergency, funding partners take cognizance of this critical need and provide unrestricted funds that allows for evolving response needs to be promptly addressed. For the COVID-19 pandemic, such unrestricted funds were provided by the Gates Foundation at the beginning of the pandemic. We received those funds on behalf of the Africa CDC. Now, some of the issues that were not initially envisaged were addressed because there was this unrestricted funding. For example, the first ministerial meeting that was held was not initially included in that budget. But this is an engagement that was necessary to define the direction of the pandemic response. And because the Gates Foundation funds were unrestricted, it enabled Africa CDC to arrange and to call for that ministerial meeting, very important meeting. And not only that, such funds enable Africa CDC to respond to various emerging needs of the country. There are many lessons, but I am cognizant about the time, and so I would want to end here. Thank you very much.
Thank you so much, Dr. Simon. Thank you for sharing about our history. Thank you for sharing about how long we've been together, and also advice for the future. So, ladies and gentlemen, I want to say thank you so much. I have so many more questions, but I mean, it's quite late in the day, and I do not want to sort of take up your valuable time anymore. So with that, I'd just like to say thank you so much for sharing with us today, and we really appreciate it. Thank you.
Thank you very much. Please, another round of applause for Dr. Therese Reyes. And of course, as the African culture, we cannot let our guests just go without a gift. So, a gift from the Africa CDC to our panelists. Thank you very much for being part of us. Thank you very much. We are wrapping up now. I would like to quickly call Mr. George to quickly give us his closing remarks as we end. Thank you.
Now, thank you very much, all of you, for being very patient. Now, this is not going to be another presentation, but rather I want to say that we really appreciate that you took time to listen to us. And again, we are coming to the end of this session. One request for all of us here, and I ask our colleagues behind there to reflect the final question that we had for the team here. Now, in the bag that you are given, there is an envelope inside addressed to Dr. Ahmed, and we have one question that we are passing over to you. Kindly take a moment and put down your response, and that will be reviewed directly by Dr. Ahmed so that he can get your direct feedback. And we are indeed sorry that we didn't provide an opportunity to get a bit of feedback from the audience, but probably that could be the best way to collect that feedback from you. Can we have the question here, please, on the screen? Now, the question is, what is your one idea that you'd want to share with Dr. Ahmed on how best we can strengthen partnerships with all of you going forward? So what is the one idea that you'd want to share with Dr. Ahmed with regard to how best we can strengthen our partnerships going forward? That's the question. And then once you finish, we have a cocktail outside that will give us an opportunity again to connect and, engage further. So we really invite all of you to join us outside. And for those of us who love football like myself, we'll be streaming, the game Morocco versus France right here. So, yeah. Yeah, so thank you very much, and we really appreciate your time with us. A round of applause for everyone.
Thank you. Maybe you can quickly grab your drink, take the best seat, and enjoy the game. For those who have responded, kindly drop your envelope. There's a box on my right. Kindly drop your answers in that box. Thank you. Enjoy the rest of your evening.